What's up, guys? Welcome to episode 80 of the unofficial NCLEX podcast. My name is Katie Kleber, and I am your host. And I cannot believe that this is episode 80, you guys. It's a lot of episodes. There's a lot of information to know for the NCLEX. So the title of episode 80 is Monitor and Evaluate Patient Response to Safety Devices and Restraints. So if your patient is in a safety device like mittens, or soft wrist restraints, a posy vest, or an enclosure bed, you have to monitor their response to it and continually evaluate it. You can't just restrain them or put on a safety device and think you're good to go. You got to make sure we're doing okay. So there are different kinds of restraints and safety devices. Check out your textbook for all of the ins and outs of those. But the frequency of the monitoring depends on the kind of restraint. There's violent restraints where you have to monitor them every 15 minutes or even more frequent if someone is actively violent. And these, working as a critical care nurse, I honestly have never used violent restraints. They are used much more frequently in the emergency department. And so making sure that you are doing this per the duration that you need to. So, making sure, hey, is this increasing? So that's my little caveat about the violent restraints. But for the rest of this, let me just kind of talk like we're maybe talking about non-violent restraints. So a posy vest, an enclosure bed, a set of soft wrist restraints, mittens, things like that. So assess based on the kind of restraint, and then, always assess their response and monitor it frequently. So if it's a patient that has a stroke and they're not moving their left hand, don't restrain their left hand. Just restrain their right hand. There's no need to do more than is necessary. And I work on that critical care unit in neuro ICU. And frequently, if a patient has had a stroke and they're not moving one side, but we need to put them in restraints, I'm not going to restrain the side that's not moving. There's no point to that. So making sure you're assessing how they're responding. Is this making it worse? I've had some where it's made it worse, and I need to try something different. Or do I need to try a different kind? I've had some where I thought, okay, they're just really picking at things a lot and they won't follow redirection. So maybe I'll put on the safety mittens, which are kind of like mittens that have a little thing over their hand. So basically they have no dexterity. It's kind of like wearing Mickey mittens, I guess, because they don't have separate fingers, and they don't have any essentially dexterity. It's nice and soft and it doesn't hurt them. But I've noticed people can kind of get out of them, or those can make things worse. So I've switched to maybe, after a little while, switch them to soft wrist restraints, and then I get the appropriate order, and it's okay, this works better. So making sure that they're responding okay and it's not getting worse. And then making sure you're routinely monitoring. So you're assessing their skin as often as you need to, and you're removing them, providing range of motion as often as you need to, and fluids and toileting and food and whatnot. And if this is something that's going on for days, that we're making sure we're getting the appropriate order when we need it. So if I put in an order now, when does that order expire? Does it expire tomorrow at this time, or does it expire tomorrow at midnight? Is it a full calendar day? Is it 24 hours? Because there is a difference. So you want to follow your policy and procedure very, very strictly with these restraints, and always remove them when you don't need them. If you've got a patient that's probably, they have a ventilator and they're dying, take off their restraints. That's something really important. So if you have a patient that you think they're not going to do well, and you have on their restraints, always look to when you can discontinue them and give them chances to get rid of them. And people that don't have the sooner you can get rid of them, the better. People do better without them. And honestly, sometimes that includes getting rid of the lines that necessitate them in the first place. So, in critical care, I find when we get rid of breathing tubes, it's a lot easier to get rid of those wrist restraints, because their breathing tube is so bothersome. And once they get rid of that, then they're just as pleasant as could be. But when they had the breathing tube in, they were just really agitated. So keeping that in mind. So you must always routinely evaluate the patient and their response when they are restrained. You can't just restrain them and leave them be. You as the nurse must do that routinely, and you must document all of this appropriately. Documentation is very important in nursing in general, but especially important in restraints, or when patients are in restraints. So this concludes episode 80 and our safety kind of section of the NCLEX. And the title of this episode was Monitor and Evaluate Patient Response to Restraints and Safety Devices. The next episode and next section will begin our health promotion and maintenance section of the NCLEX. So thank you guys for hanging in there with me for 80 episodes. And I hope this is helpful to your NCLEX journey.
This has been another episode of the unofficial NCLEX Prep Podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.